Dr. Sarat Chandra Dash, retired Additional Director, Health and FW Department, Odisha. I am joined in a contractual job at CDA, Kotak. Also, I am doing my own practice at Sector 7, CDA, Kotak, in front of Markat Nagar Police Station. Today, I am going to discuss a topic, understanding the link between diabetes and GERD. Then first of all, I like to tell you that what is diabetes? Diabetes is two types. Number one is juvenile onset diabetes, which is present from birth. Another is adult onset diabetes, which comes after birth at the age of 30 to 40 years. What happens in diabetes? A group of disease that result in too much sugar in the blood or high blood sugar. There are two types, type 1, type 2. Type 1, insulin secreted from the beta cells of pancreas that controls the blood sugar and keep it in normal level. But in type 1, beta cell of pancreas does not secrete insulin or secrete very little insulin. It is present from birth. Type 2, pancreas secrete insulin which is not sufficient for body requirement or sufficient secretion of insulin, but body fails to utilize it. So we know diabetes is a group of disease where blood sugar level is high. Normal blood sugar level, fasting within 100. If fasting is 100 to 125, it is pre-diabetic, and if it is more than 126, 25 to 100 to 125, it is pre-diabetic. If it is more than 126 milligram per deciliter, then it is diabetic. Then let us discuss what is GERD. Gastroesophageal Reflux Disease, GERD, is one of the digestive issue which occurs when stomach acid and bile flow back into the esophagus. Esophagus means food pipe, irritating the protective lining of the esophagus. This condition can damage the esophagus and lead to long-term inflammation, esophagitis. What happens? Trouble in swallowing and in increased risk of esophageal cancer. So diabetes is a long-term condition where the body does not make enough insulin, a hormone that controls blood sugar level, and cannot use it properly. When diabetes is not treated, blood sugar can get too high, a condition known as hyperglycemia, leading to serious damage over time, especially to the nerves and the blood vessels. While GERD is more common in people who are overweight, it occurs more often in those with diabetes, regardless of their weight. So let us learn what is the link between diabetes and GERD. In people with diabetes, GERD can happen due to many factors, including obesity, nerve damage, and hormone imbalance. Obesity increases pressure in the abdomen, which can lead to a hiatus hernia. Part of the stomach extends to an opening of the diaphragm into the chest, weakening the esophageal muscle and causing acid reflux. Diabetes-related nerve damage also affects movement of stomach and esophagus, leading to acid reflux. Diabetic autonomic neuropathy is a condition where diabetes damages the nerves that control important functions like your heartbeat, blood pressure, sweating, digestion, urination, and sexual function. When the nerves in the stomach and the intestine are affected, it can lead to delayed stomach emptying after meals. This can cause symptoms like bloating, belching, heartburn, nausea, or vomiting. Especially in patients with type 2 diabetes, high blood sugar, also known as hyperglycemia, can lead to many changes that affect the digestive system. These include increased stomach acid production, higher level of bile acid, lower bicarbonate level. Additionally, people with type 2 diabetes may experience slower emptying of the stomach and esophagus, more frequent relaxation of the lower esophageal sphincter, a muscle at the bottom of our esophagus, and low pressure in the lower esophageal sphincter during high blood sugar. Conditions like hiatus hernia and a higher rate of obesity may also play a role in the development of a GERD in people with type 2 diabetes. Now, few questions comes to our mind. Number one, how does diabetes affect GERD? We have already discussed some problems. Have also found that 40% of diabetic individuals also suffering from GERD, regardless of weight. This indicates a more direct connection between diabetes and acid reflux. Studies suggest that diabetic neuropathy, nerve damage due to high blood sugar, accounts for GERD symptoms in diabetes. Can sugar increase GERD? There is also a question. But studies have shown that GERD is more likely to arise in these patients when consume more sugar. Thank you.